Good morning, evening, good night, everyone. Welcome back to Lana's Little Things with me, Dr. Lana, specialist gerontologist. Good morning, good evening, good night. How are you? How is everyone doing? We talk about all sorts of things here: living agelessly, family caregiving, bridging generation gaps, and life itself. What's the topic for tonight? Well, some night by me. What's the topic that we're going to cover tonight? I thought we'd just stay with water because last week's discussion got so much feedback. Thank you so much for the things that have to be considered when an older person may seem to be resistant or reluctant to shower. So, why aquatherapy? What is aquatherapy? We're going to discuss what is and 5 reasons why it can help. Well, so anybody can go in about the water, well, almost, unless you have a fear of going into the water, which is a different story altogether. I live on an island. If I could be able to see every single day, I certainly would love the ocean. I understand that many of you may not share that passion, and in temperate climates, it's just not practical to be outdoors in the sea, even if it's suitable. So, aquatherapy is essentially water based physical therapy. It can be used for recovery from uh, an operation, or recovering from a stroke, or having just had surgery and you need therapy to get back, to get strong again. And it's a safe, great aerobic exercise. Those of you who feel as though you're not getting in any exercise. So it's used for so many of those reasons. So what are the 5 reasons? Let's just dive into it. Really, can you imagine when a doctor tells you or anyone tells you to exercise? First thing you think of is, well, first thing I think of is water, walking, then jogging. I don't run. It's bad on your joints. All sorts of theories and so on. But how many have considered aquatherapy? Hmm. And why would you need that? How does it even work, going into the sea or a pool and having stretch your legs and stretch your arms? I mean, it just seems kind of like maybe I should be outdoors doing something. But for you in temperate countries, that might not always be possible. There's winter. You're gonna do it outside, outdoors? No. So then how do you maintain your exercise? How do you maintain your fitness? How do you keep yourself steady and be stronger so that you live longer? Right. So that's basically what aquatherapy is all about. And it's used in strength training, it's used in water jogging. There's even dance moves you can do in the pool. And I say pool because most people do not live on an island like myself. And trust me, even on this island, on the island, sometimes we just take the sea for granted. Or some people are terrified of the ocean because of experiences they had before. So we're going to talk about aquatherapy specifically in the pool and how it's done. So we'll discuss what it is. It's water-based therapy. Why do we need it? Would you need it as you get older? Why is it so important? Well, we're going to discuss 5 main reasons why aquatherapy works and why I would certainly recommend it to my patients, clients, friends, older persons, and for, well, any age really. And I would love for you to share this with your family and friends. So remember to like and subscribe and press the notification bell for any other updates. So the one of the main reasons I've in researching I found, and it makes sense. Jogging, walking, skipping, and all those heavy activities, so to speak, not every older person can do it. Some might have better fitness levels than others, but generally speaking, if you are in pain from an arthritic knee or shoulder, or your back hurts, or your post therapy, post surgery, or any procedure that renders you relatively immobile for a while, how are you going to get outside and walk and jog and skip and bicycle and all those things if your joints hurting? I mean, like, or period, if it is cold outside, snowing. So, Aquatherapy really is a wonderful thing because the person who's taking the older person through Aquatherapy is a trained, licensed professional physiotherapist who will be able to take you through the paces that you need, knowing how it works. So we have we're going into number one. Well, it's easy on the joints. We just spoke about what's not easy on the joints. You're practically weightless in water. So you will not likely jar anything because water flows. Water is not a hard medium that anybody and anyone can get into it. Now, I do understand there are people who have had bad experiences with the sea. I live on an island. I love the sea. I could be in the sea all day if I, well, not all day, but if I could go to the sea every single day, oh, I sure would. But for seniors having weaker joints, feeling frail, or just the process of aging does affect the joints. It can cause pain, limited mobility, lack of stability, all those things. So we don't really want to do outside stuff. So consider going and doing Aquatherapy. The one reason it is easy, another reason why it's easy on the joints is because there's some land activities, while jogging, running or walking, or outdoors, it may not be safe for an older person to be outdoors on their own doing all these things. Those days, these days are different days. So because water is buoyant, it allows you to feel weightless. You put less strain on the joints. You put less to none strain on the joints. And it's an excellent way to get into shape. Hey, and who doesn't want to get into shape? Not lose weight, but get into shape and feel better and be in less pain. What's another? And that was my favorite. What's another one? Well, it enhances your mood. It reduces anxiety because there's a connection with man and water. Babies recently, a couple of years, are we're doing water births. Persons who prefer not to go into the sea because it means transportation, getting everything together. You might not live near the sea. It's demotivating. But if you can find a pool near you with a licensed therapist, that'd be awesome. Anything that enhances our physical health also enhances our mental health. And when you've come from, well, let's just say walking or doing your own exercise, or for those of you who would have gone to the sea or gone to the pool, you know how good it feels. Water is so much therapy. We're not 70% water for nothing. So that's the inside, but obviously outside we want to be able to release those sweet, good feeling hormones, those endorphins. All right, and so why not? That's and an added advantage of being in water. You do feel your stress like melting away in the pool as the person takes you through the exercise. It's also fantastic because it's a social scene. Although some people do like private therapy if they have their own pool and they may not want to venture outside. But either way, if you do get to venture outside and you do have an aquatic area therapy, by all means, go. You will be able to you see your peers, you chat, you meet new friends. It is a social scene, so it also, for that reason, improves your mood and tendency for anxiety. Huh. What's the third one? Well, you're exercising. You're going to, it's surprising how people say to me so many times, but Doc, I did not realize that this was so easy. I felt my heart rate go up. I felt like I was really having a workout. I didn't think water was going to be able to do that. How is it able to do that? Well, it fools you into thinking it's fun and it isn't work. It isn't prescribed. It isn't like you must do this or you will fall apart. No. And yet, the aerobic exercise is targeted to strengthen heart muscles, to enlarge or enhance and improve the lung capacity, because as you get older, your lungs get stiffer. The heart also gets stiffer. There's higher tendency for high cholesterol and heart disease. So heart rate does go up when you're exercising in the water. The water pulls you, pushes you, and the therapist is going to pull you and push you. And that's not only fun, but it's aerobic exercise in its own way. Think of it as weight exercises. One of my favorite things to do in the ocean is to like pull the water. See how much as from gathering it in my hands. And by the time I'm doing that, my arm strength feels so different. So I know for sure, if you think about it and you're safe, it's safe to do, by all means, consider that. You get greater improvement in cardiovascular health, lung health, and it also helps your bowel to move better because your gut motility will increase. So, hey, it's the benefit to everything. It's Aquatherapy benefits like everywhere. Talked about stability. So, our fourth one reason Aquatherapy is so important is it's great for balancing, it's great for strength. Strength training. Now, you say strength training again, water has its own resistance. And therefore, if you are having a weakness, you can actually use the water, which makes you feel weightless and still guide your bone, the body through the motions, legs, upper limb, neck that might have been stiff. And then you come out of the pool feeling like $1 million. It, it just feels like I got a workout and I was safe. And I'm getting more feeling and balance on my feet. I feel stronger. Who doesn't want to feel stronger? Who doesn't want to feel like they can manage? As you get older, everybody's telling you what to do. They want to tell you don't drive. They want to tell you don't go outdoors. Don't do this. Aquatherapy has almost no restrictions to it because it's just water. And the therapist is there to help you to know what to do anyway. And then you can continue on your own. And it's a group exercises, it's social. So, not to mention that a pool is one steady body of water. It's not like the sea, which I can understand why a person is afraid of the sea, because the sea is going to have tides, and every single tide, as an older person, sometimes it can feel as though you are fighting against the, the pull of the water. In therapy, the pool has a steady stream. It's really like just a quiet body of water. And you do the motions. So you get to control how much you can do according to the therapist's advice. You get to be in less fear because you're not certain if you might step on a rock, step on something that might hurt you, any one of those sea creatures. Not saying the sea is not safe, but as an older person, these are realities, right? And if you are waist deep, you can do leg exercises. You can bring your hands out of the water, and that automatically makes your muscles feel great. You can kick underneath, from waist down. Even if you kick, you move. If you have back injury, the therapist will take you through how to gently move your trunk again so you can bend and stretch better. Why is that important? Stability and balance. So that's a no-brainer because you're gonna feel balanced, you're gonna feel stronger, you're gonna be able to not only reduce frailty, which can lead to you being more prone to stumbling, falling, fractures, the like. Aquatic therapy is a safe alternative. So such a safe alternative. What's number five? Well, it's great for decreasing any swelling. For example, osteoarthritis, arthritis in any joint can cause sets up an inflammatory process, and then you can notice, oh, especially when it rains. You older ones. I can tell the weather because my knee is hurting, my shoulder hurting, joints. It can tell the difference. And then sometimes if you have an injury, or sometimes just from the aging process and not being active, the area is going to try to protect itself. And so it's going to send the white cells to the area, which in turn will cause some swelling because the whole plasma won't go into all that, but the whole flow of blood when you are exercising, when you're in the pool and your legs are feeling tired and just can't move again, or arthritis is so draining. Aquatherapy decreases the swelling, improves the circulation. Again, that hydro pressure puts your demands of your joints, demands of your muscles, movement in a safe environment. So we've discussed those three. Which one did you find was the easiest? Is the best one that you found to be more palatable, shall we say? Your joint, your mood, the social scene that it is, the improvement in lung and heart health, the balance and strength, and improving your circulation. You come out stronger. You really, really do. It reminds me, maybe we should really just go to the beach sometime next week. I think I'll do that. All this talk about going to the sea makes me want to go. So, hope this was helpful. So, next time you are considering what do I do for exercise? I'm supposed to move and keep my joints healthy. How do I do this safely? Join an aquatic center, call in a therapist who's trained in that, and just get moving. For those of you who are not in it, who don't feel unstable, you can go to the sea if it's in your area. You can still just have a swim in the pool with or without a therapist, safely monitored and supervised, of course, and you still come out feeling you've done something good for yourself. So I can't think of any other. Those are the five reasons. I really love those five. Those are my favorite five, but there are more. And I'm sure that you have your suggestions on what could be done to improve circulation, have someone not be in pain, not have to be groaning, just feeling easy as you flow with the water. Consider it. Talk about it. If you're definitely afraid to do it, well then don't. But if you have trepidations and someone can allay your fears, well then do. Because it really does help. It really does. So share with a friend. See all those reasons why Aquatherapy really does do a great job. It is really, really wonderful. And feedback to me. Did you try it? Have you ever done Aquatherapy before? Does it work? Do you have any other suggestions on what you can do in the pool as an exercise with supervision? Do you agree with these comments? Do you disagree? What are your ideas? I would love to hear. Thanks so much for the time. Dr. Lana sending out, saying from my heart to yours, good morning, good evening, good night. Stay healthy, stay happy, stay safe, stay strong.